Do you notice your ankles swelling by the end of the day? Shoes feeling tight? Feet feeling heavy? You might think this is just a normal part of aging. But I've treated hundreds of patients over the past 30 years, and I can tell you that persistent swelling is never just normal. I'm Dr. William, and today I'm going to share everything you need to know about swollen ankles after 60. The hidden causes, what your body might be trying to tell you, and the steps you can take to reverse it naturally. You'll hear real patient stories from the US, UK, Canada, and Australia. These are patients I personally treated, showing how simple lifestyle changes, exercises, and diet adjustments can make a huge difference. By the end of this video, you'll know exactly what to do if you notice swelling, how to prevent it from worsening, and how to regain comfort, mobility, and confidence. Patient story. Mr. John Harris, 67, from Chicago, came to me complaining that his ankles felt heavy and tight every evening. He assumed it was just aging. During our consultation, I noticed swelling in both legs and a subtle puffiness around his eyes. I explained that fluid retention could indicate early heart or kidney issues. We monitored his weight, adjusted his diet, and implemented gentle daily exercises. Within weeks, his swelling reduced and he felt more energetic. Understanding edema. Swelling, or edema, occurs when excess fluid builds up in your tissues, often in your feet, ankles, and lower legs. After 60, several factors increase the risk. Slower circulation, reduced vein elasticity, and less efficient kidney or liver function. Temporary versus persistent edema. Temporary swelling is often due to salty meals, long periods of sitting, or hot weather. Persistent swelling, however, can be a sign of something more serious and should never be ignored. Patient story. Mr. David Carter, 72, from Toronto, had mild morning ankle swelling. He assumed it was age-related. On examination, I detected early signs of chronic kidney disease. We adjusted his diet, monitored fluids, and tracked his weight. Within months, his swelling reduced and he felt more energetic. Edema is your body's way of signaling that something is off, whether it's your circulation, kidneys, heart, or liver. Understanding the why is the first step to prevention and recovery. Heart-related causes. The heart is a pump, and if it weakens, fluid can collect in your legs. Bilateral ankle swelling may be an early sign of heart failure. Symptoms to watch for. Swelling in both ankles. Fatigue. Shortness of breath. Sudden weight gain. Patient story. Mr. Robert Thompson, 68, loved gardening but noticed ankle swelling and fatigue after a few steps. On examination, early-stage heart failure was suspected. We prescribed medication, lifestyle changes, and gentle exercises. Within weeks, he regained energy and swelling decreased. Follow-up. Mr. Thompson returned every 2 weeks for weight, blood pressure, and swelling checks. He reported feeling stronger and more energetic, demonstrating how early intervention protects heart health. Kidney-related causes. The kidneys filter waste and regulate fluids. When they're not functioning well, fluid can build up in the legs, hands, and even around the eyes. Symptoms include ankle swelling, puffy eyes, fatigue, foamy urine. Patient story. Mr. Daniel Brooks, 72, from Sydney, had morning ankle swelling and puffy eyes. Tests revealed early-stage chronic kidney disease. By monitoring fluids, adjusting diet, and tracking weight, his swelling decreased over weeks. Patient story. Mrs. Rachel Adams, 69, noticed slight swelling but ignored it. Routine checkups revealed mild kidney impairment. Implementing light exercise and dietary changes prevented further progression. Tips for kidney health. Maintain hydration. Reduce sodium gradually. Include potassium-rich foods. Keep a daily symptom journal. Follow-up story. Mr. Brooks tracked his daily intake and exercises. Within 3 months, swelling minimized, energy improved, and kidney function stabilized. This highlights the importance of consistent monitoring. Liver-related causes. The liver also affects fluid balance. Reduced liver function can lead to swelling in the legs and abdomen. Symptoms include bilateral leg swelling, abdominal bloating, fatigue, yellowing of skin or eyes. Patient story. Mr. Michael Foster, 71, from London, had ankle swelling and mild bloating. Liver function tests showed mild impairment. Implementing a liver-friendly diet, medications, and monitoring swelling led to improved energy and reduced edema. Follow-up story. Mr. Foster tracked his meals and fluid intake daily. Over 2 months, swelling decreased and mobility improved, demonstrating how lifestyle choices support liver health. Medication and lifestyle factors. Certain medications may cause fluid retention. Blood pressure medicines, steroids, diabetes medications. Lifestyle factors. High salt intake. Prolonged sitting or standing. Lack of exercise. Patient story. Mr. James Walker, 70, had swelling due to blood pressure medication. Adjusting treatment and incorporating daily walks reduced swelling significantly. Patient story. Mrs. Abigail Scott, 68, had ankle puffiness due to sedentary habits. Adding 10-minute walks, stretching and elevating feet after meals improved swelling within weeks. Even minor lifestyle adjustments can produce substantial results. Daily exercises and practical steps. Steps to reduce swelling. Elevate feet above heart level 3 to 4 times daily for 15 to 20 minutes. Gentle exercises. Walking, ankle rotations, calf stretches. Compression stockings if recommended. Balanced diet. Fruits, vegetables, lean proteins. Reduce salt and processed foods. Patient story. Mrs. Linda Evans incorporated ankle pumps while watching TV. Within weeks, swelling reduced and mobility improved. Daily exercise routine. Ankle pumps while sitting. Calf raises against a wall. Gentle stretching. Short walks multiple times daily. Follow-up story. Mr. Daniel Brooks integrated exercises consistently. After 1 month, his legs felt lighter, walking became easier and swelling was controlled. Red flags and urgent signs. Sudden swelling in one leg with pained possible blood clot. Chest pain or difficulty breathing heart/lung emergency. Rapid swelling in both legs heart, kidney or liver issue. Patient story. Mr. Thomas Green, 71, ignored swelling and chest tightness, resulting in emergency hospitalization. Early action is critical. Swelling affects mobility, confidence, and independence. Patient story. Mrs. Abigail Scott, 68, felt anxious about swollen ankles. Following daily exercises, monitoring fluid intake, and tracking progress restored confidence and independence. Consistency is key. Small daily actions lead to long-term benefits. Nutrition and daily habits. Reduce processed foods and excess salt. Eat potassium-rich foods, bananas, oranges, spinach, tomatoes. Include protein for muscle support. Hydrate appropriately. Anti-inflammatory foods, berries, leafy greens, fatty fish. Patient story. Mr. Andrew Hill, 69, adopted a balanced diet, monitored sodium, and added daily walks. Swelling decreased and energy improved significantly. Follow-up story. After 3 months, Mr. Hill maintained these habits. Swelling stayed minimal, mobility improved, and energy levels increased. FAQ and viewer questions. Q1. Can edema disappear overnight? A1. Temporary swelling can improve, but persistent edema needs evaluation. Q2. How often should I elevate my feet? A2. 15 to 20 minutes, 3 to 4 times daily. Q3. Are compression stockings necessary? A3. Only if recommended by a doctor. Q4. Can walking help? A4. Absolutely. Gentle movement improves circulation and reduces fluid buildup. Patient stories. Multiple patients, like Mrs. Linda Evans and Mr. Daniel Brooks, improved significantly by incorporating these habits. Swollen ankles after 60 are common but should never be ignored. Early action, proper medical guidance, and consistent lifestyle adjustments protect your heart, kidneys, and liver. Maintain mobility, comfort, and independence. Small changes, applied consistently, produce long-term results. Thank you for watching Urologist USA today. Listen to your body, take action, and remember, your health is your most valuable asset.